Assalamu alaikum viewers, you are watching Dr. Irfan Mughal YouTube channel. Today, we will discuss about a medicine named as Levofem. What is Levofem? Levofem is a daily birth control pill designed to help women prevent unplanned pregnancy. It contains a low dose of two female hormones, levonorgestrel and ethinylestradiol, which work together to stop ovulation and make it harder for sperm to reach an egg. It is for regular, everyday use, not for emergency contraception. What is Levofem used for? Prevents pregnancy when taken consistently every day, regulates menstrual cycle and makes periods more predictable, helps with painful or heavy periods, can improve mild acne and hormonal imbalances in some women. How to use this pill? Take one pill daily at the same time each day, preferably after a meal. Comes in 28 tablet packs, 21 active pills, and 7 iron placebo pills. Start on the first day of your period, or the first Sunday after your period starts. Do not skip pills, even during your period. Pills also have some side effects. Common side effects are nausea, breast tenderness, headache, mood changes, light spotting, especially in the first few months. Rare but serious side effects are blood clots, high blood pressure, vision changes. Stop and see a doctor if you experience chest pain, severe headaches, or leg swelling. Important tips: not suitable for breastfeeding mothers in the first 6 months. Doesn't protect against STIs or HIV. Use condoms for protection. If you miss a pill, take it as soon as you remember. If it's more than 24 hours late, follow the missed pill guide. Avoid smoking while on Levofem. It increases risk of side effects. Thanks for watching.